proud to be here this evening with my colleagues to host the Republican Leadership Hour. We are going to talk to the American people about the damaging taxes levied against them by the President's health care law, the cost to consumers, the IRS's role in enforcement of these tax provisions, and the rocky implementation of the law. The President's health care law contained 21 new taxes, many of which will impact low and middle income earners. Together, these taxes represent $1 trillion tax hike at a time when American families certainly cannot afford it. And although it became law in 2010, the two linchpins of the law, the employer mandate and the individual mandate, were not scheduled to be implemented until 2014. My colleagues and I have consistently expressed our concerns to the President and our Democrat colleagues that these two taxes would present both an undue economic burden on our constituents and a logistical nightmare for the administration to implement. On July 2nd, the administration announced in a Treasury blog post that it would delay enforcement of the employer mandate by a year until 2015. One administration official said that the President justified this decision to delay this tax on business because it began, and I quote, listening to businesses about the health care law. I've been hearing from businesses about this tax for 3 years, and I'm sure the President has as well. I'm glad that he saw the light. I'm also pleased that the House came together in a bipartisan manner yesterday to pass a bill reaffirming the decision to delay the employer mandate tax for a year. However, a delay of the employer mandate will not give any relief to individuals who do not have employer-sponsored health care, nor will it give any relief to employees who have already been converted to part-time status by their employers in anticipation of the employer mandate. These American families will still face this excise tax, even though the President is giving big business an escape hatch. We believe the administration has set up a double standard for compliance with this unpopular law, and that is why the House is working to delay the individual mandate as well until 2015. As things stand now, on day 2 of open enrollment, the health care exchanges in many cases have simply not been ready. A report issued this summer by the Government Accountability Office found that many of the state health care exchanges will not be operational and will complicate individuals' efforts to comply with the law. I know that many of the members speaking today will share stories they've gathered so far, and my state of Kansas has been a good example of the confusion that these delays are causing. Officials are already counseling my constituents to wait to purchase benefits for a few weeks until the exchange's kinks are worked out. I find this unacceptable. Additionally, the administration has announced that the subsidies available to individuals when purchasing insurance will not be verified by the federal government, and that individuals will have to self-report information regarding their income. This paves the way for fraud and abuse of taxpayer dollars. Finally, at the heart of this law is the IRS's role in enforcement of the President's health care law. This is an agency we all agree is mired in scandal, or maybe even worse, a culture of incompetence. We do not think this is the appropriate time to be increasing the IRS's workload with enforcement of these new taxes, and questions abound about the security of taxpayers' information in the federal data hub. I look forward to spending time with my colleagues this evening discussing these issues, and at this point I would like to yield to my